Good evening. I'm Mayor Ron Nirenberg with Bexar County Judge Nelson Wolff. We're joined tonight by Chief of Epidemiology RITA ESPINOZA with San Antonio Metro Health, along with Dr. Brian Alsip, who is the Chief Medical Officer for University Health, and this is our COVID-19 update for the San Antonio community. Tonight we're reporting 166 new cases of COVID-19, which brings the total to 202,716. Our 7-day moving average is now at 176. Thankfully, today we have no new deaths to report. We have lost 3,071 neighbors, friends, and family members to COVID-19. Those numbers were updated over some death investigations from the weekend. I want to remind you that every single one of these numbers is a loved one who we are dearly missing, and so please keep their friends and family and survivors in their prayers tonight. We've lost too many of our loved ones in this community from COVID-19. We're seeing more improvements in our hospitals this evening. There are 188 COVID-19 patients in local hospitals. That's the lowest number, again, since our downturn began. There were 19 new admissions in the last 24 hours. That's also a low number that we're thankful to see. 81 patients in the ICU and 46 patients this evening are on ventilators. Now, let's go to our progress and warning indicators, and there's some good news here. After we saw a little bit of an uptick last week in our positivity rate because of testing, we're now seeing it back down, now to the lowest point it's been since April of 2020. That's great news, 2.3% positivity rate, and as a result, the risk indicator bar remains at the lowest setting. Great news again, but please, we're reminding you not everyone in this community is vaccinated, and we still need to follow our health and safety protocols, so please do not let your guard down, mask up, and practice social distancing. As of yesterday in our community in Bexar County, we have 416,797 people who have received their first dose vaccine, and a full 232,004 people are fully vaccinated. All good news. Let me turn it now to Judge Wolff.
Yeah, thanks, Mayor. And everything is certainly pointing in the right direction, but let's just kind of set the context for that. Here we are, March 22nd, is that right? And the President of the United States says his goal is to, by July 4th, have us back to life normal. But that means we still got 3 months to go through to make sure that we don't trigger something that could come back to haunt all of us. So, again, thanks a lot for what everybody's doing with respect to face mask and social distance. Just bear with us another 2 or 3 months, and we should be home. We should be home safe and get back to normal life in the United States. As the mayor said, we're down to 188 in the hospital. When we had the summer surge, between the summer surge and the winter surge, we reached 184, which is our lowest number in the hospital. So we're right approaching that, and we're heading in the right direction. And we just got to keep it up now for 2 or 3 more months to get us through this. Vaccines, last week we just, Dr. Alsop, I don't know what you guys did, but you must have worked a little hard because you did 31,202 vaccinations just last week, and that's first and second dose of Pfizer. So that's a huge number to do, and that's by far our record for 1 week with University Hospital, Bexar County Hospital District, and doing the Wonderland and the downtown. That brings us up a total now to 220,048, about half of all the vaccinations that have been done in the city. So, again, congratulations this week, starting with teachers and the school administrators this week and carrying through the week. And then we're going to see what happens. Several states have opened up for anybody to get a shot. At some point, the governor of the state of Texas will probably make some sort of an announcement, and we'll have to be prepared for that.
Yeah, and we certainly hope they're accompanied by more vaccines. So thank you, Judge. I do want to make an urgent call to you listening tonight. The South Texas Blood and Tissue Center reports that the demand for blood continues to be 25% higher than normal, and at the same time, the inventory is upside down. What that means is the South Texas Blood and Tissue Center is sending out 100 more units of blood every day than it's taking in currently, and that's not a good thing. So we need some help with blood donations. Over the past weekend, blood donors filled only 60% of the appointments that were available at the blood center, so we need you to make that call, make your appointment. If you're able to donate blood, please do it as soon as possible. The total blood inventory remains at a critical level at just 2 days' supply. The type O blood is under a day, and that's, again, the type used in emergencies. So the only solution to this is for us to come together as a community to donate blood. Patients in our hospitals are counting on us to step up to the challenge. The South Texas Blood and Tissue Center has 6 donor rooms available in this area, along with mobile drives across the region. Please make an appointment at southtexasblood.org or call University Hospital at 210-358-2812. And also we want to remind you that if you need assistance paying rent or mortgage during this crisis, you can call 311 to access our emergency housing assistance program. Also, if you're out of work and without an income and would like to train for a job that's available in our community today and receive a stipend while you do so, you can enroll in our job training program at 210-224-HELP, or again, call 311 for more information. Finally, if you'd like to sign up for the text alert system for an alert when the vaccine appointments are available in our public health providers, you can text vaccine or vacuna to 55000. And finally, if you want to get the latest on COVID-19 in our community, text COSA-GOV to 55000 or go to the website covid19.sanantonio.gov. Please continue to do our part. As the judge said, the light is at the end of the tunnel, but we have to get there together. Mask up, practice social distancing and proper hygiene. Do it for yourself, do it for your family, and do it for San Antonio. Rita, myself, the judge, and Dr. Alsip are available for questions.
Our first question tonight is for Rita. Is there a breakdown of how many variant cases that have been recorded in Bexar County?
We're aware so far of about 6 cases of the B117. That's the UK strain that has been seen. And what we know of those individuals, they have all fully recovered and none of them were hospitalized. So they didn't have any more severe illness than other COVID cases.
Another one for Rita and Dr. Alsip. Would you hypothesize that the decreasing positivity rate is due to a rising number of fully vaccinated residents?
Well, what we want people to do is to get a vaccine as soon as they're eligible. And I think with the statistics that the judge shared earlier, I think we've made some significant progress. I think the mayor has given you numbers that indicate we're close to that 10% for fully vaccinated for all of Bexar County and probably 20% for a single dose. That's not anywhere near herd immunity. So I think we have a long way to go, but it's certainly moving in the right direction.
Is there any evidence in the case numbers that suggests lifting the state mask mandate is having an impact?
At this point, we're really not seeing an increase in cases since the lift in the mask mandate. We're still urging individuals, and the public health recommendation is for individuals to continue to mask up.
We have a little better idea. But first of all, I think here in San Antonio, I don't know about the rest of the state, I think everybody is really, really stepping up and continuing to do the mask. We'll have a much better idea, I think, if it does have any impact. Hopefully it will not. After the spring break, I think there were 2 different weeks when we had spring break, so maybe another week or 2 before we see if that was any impact or not.
Yeah, to reiterate, despite what the state mandate may or may not say, you can still choose to protect yourself and your loved ones by wearing a mask, and we're glad that a lot of people are, and we're glad that a lot of businesses continue to require that, and we will help those businesses out in terms of removing people who don't comply if they have chosen to make that one of the rules for their businesses.
Is the positivity rate somewhat distorted from lower testing during spring break?
I don't think it's necessarily distorted. We have seen fewer tests being conducted, but of those individuals that are going to get tested, just fewer are turning out to be positive. It kind of goes back to the reason why are they getting tested. A lot of the individuals may have symptoms, but it's just showing that the COVID level right now is low in the community.
Does contact tracing show there are cases coming from people who say they traveled during spring break?
So far, we're not seeing that in the data, that the contact tracing is leading back to spring break travel as it did last year. Last year, we know a lot of the cases that started had to do with travel due to spring break.
What is the status of vaccinations at the Alamo Dome with the women's NCAA championship taking place over the next couple of weeks? Are vaccinations still going to happen at the Alamo Dome parking lots?
Yes, we are still continuing the operation. It is all outdoors, drive-through, and so we have collaborated with the NCAA to make sure those operations could continue smoothly.
We've now seen a year of COVID deaths in Bexar County as of today. Do you know where the COVID ranks among the causes of death?
Well, I asked Dr. Bridger that question the other day. We, on average, in a 12-month period, lose about 3,000 or so people to heart disease, and roughly around the same to cancer, correct, Doc? So, you know, again, these numbers are what we would see in those two leading causes of death.
That's correct.
That's all we have tonight. Thank you.